Just over 20 years ago, as a new graduate from med school, I opened up the first medical clinic with my brother in Toronto, Canada, called Avicenna Health Centre. Avicenna is the name of one of the greatest physicians of all time, who's from where I'm from, Iran, and he lived over 1,000 years ago and really developed the whole philosophy of true medical practice, caring for the person, but also their spirit as a whole individual, and really led the way for physicians that came after him, and including Western medicine. At that time, I didn't know what a real medical clinic would be like. So I did what I was seeing around me. We set up a clinic that had myself, my brother, and other practitioners there, and we were generally practicing the Western model of medicine that we had been taught. Over the years, as I learned the true power of the body and the mind in healing, and that we could really rely on basic things like nutrition, movement, mindfulness, breath work, nature, creativity, and the arts to not only heal ourselves, but to fulfill our higher potential, the vision for a real center, for the future center, for the prototype center of health, wellness, and human potential, that seed was planted in my heart. Over the years, I kept imagining what would that center look like, and had the blessing of several years ago in Ottawa, Canada, to have the support of an amazing team who helped to bring this center to life as the prototype of the center, where people can come in and learn through the education and support of various healthcare practitioners, including Western trained physicians, how to tap into their health and well-being potential, how to celebrate the human frame, mind, and ability, and how to really tap into their own power to fulfill their destiny and share their gifts and creativity with the world. And today, I'm going to take you on a tour of this prototype center of the future we've created now, called Amani Health, and how we would love to see, I would love to see one of these centers in a bigger way in every single major city around the world, where people can come in and explore what it is to be human and what it is to have amazing abilities to heal ourselves and to live our potential. So the first key thing is, when you come to the health center of the future today, it has to be beautiful. It has to be uplifting. It has to be bright, incorporate nature, natural lighting. Why? Because those are all things that we as people resonate with, we're aligned with, they inspire us, they bring out the true power within us. So that was our aim here at this prototype center, Amani Health, to bring that vibrancy, to bring that light, to bring that beauty, so that when people come through, they're actually feeling good and also celebrating the beauty of life within an environment that's going to be supporting them and educating them on how to tap to their inner potential. I'm going to give you a diagram that actually we've modified. So everything's evolving, obviously, and so as our knowledge and our understanding evolves, we want to incorporate that. So we created this a few years ago to really show how our wellness program, The Real You, works, but we've already modified it. But I'll give you an example of what we've had and then how we've modified it. So basically, you are at the center. This is your life. You are in charge of your destiny, and your health is the foundation for that and your potential. Around you is ideally your healthcare human potential team. And so the medical doctor's role is really important in comprehensive medical screening, exam, referral to any specialist, and ongoing medical care. But more importantly, how this program and this new paradigm of healthcare is very different than what we currently have, is that the medical doctor's role will be to guide you to your inner potential, to your power, and teach you how important food and movement and breath and nature and all those things that we've talked about are in your journey to health and well-being, and also connect you to the other very, very equally important key practitioners on your team. So here we have physiotherapy, because physiotherapists are actually taught as a discipline, have the most education, I believe, in terms of how the body works, its function, its mobility, and how to optimize that. So the physiotherapy on your team would help you, first of all, doing a fitness assessment, but also then help you prescribe exercise, prescribe movement to not only prevent disease, but also to optimize your health and well-being, because we know a strong body is required for a calm, strong mind, and vice versa. Then we have naturopathy, but how I would change this now is actually a nutritional specialist. Now that nutritional specialist, depending on your doctor's training, could be your medical doctor, but it could also be other people who are educated in the role of nutrition in prevention of disease and health promotion and longevity and vital. I don't like anything anti-vital aging. So we know that nutrition is foundational to health and well-being. I would say more than 80% of the diseases that we see out there, chronic diseases in particular, can be reversed and treated through proper nutritional education and foundation. So having a nutritional specialist on your team to tailor and to teach you how to eat well for prevention, treatment of disease, and also human potential is key. Here we have psychology, but we don't really need a psychologist per se. We need someone who's been trained in the development and the power of the mind to reach your potential and again be healthy and strong. And so you would have, we've had on our team psychologists that have done this role, but again, it could be your medical doctor who is training in psychotherapy, it could be a registered psychotherapist, it could really be anybody who's done, it could be a really skilled person who's studied psychology and is a life coach, somebody who can really help you develop awareness of your own, again, thought patterns, how you deal with difficult emotions, how you deal with trauma, that we've all been experienced and exposed to trauma, some more than others, how you can heal from trauma and move on and living your life as best as possible in your power today. Then we have a separate role for yoga. So the health centers of the future would have all these key people as your team, and yoga and a yoga instructor, again, would be very, very important, because yoga addresses things that none of these actually areas and specialties address, which is how do you use your breath with mindful movement to access, again, your health and well-being potential. And that's why yoga was developed thousands of years ago, with the idea that if everyone were to do yoga, you can watch our Yoga is Medicine video, if everyone were to be doing yoga, you can actually not only fulfill your destiny individually, but collectively really lead to a more peaceful, loving, and just world. And finally here, now there's many other aspects here that the updated version of this diagram will show. But finally, in this diagram, we've touched on the role of massage or touch therapy, because we know as people and even as plants, actually, touch is very, very important to our well-being. Hugs are very important to our well-being. They've known to show benefits. And so having a massage therapist or people who are experts in tissue manipulation and teaching you how to become aware of your body, how to become comfortable with touch, and how to support your musculoskeletal system, but also your mental health actually through the power of touch. There's a lot of amazing people out there who are working with massage and healing and well-being. One of them is Dr. Peter Levine, and that would be an important facet of your health team. I would add to this diagram things like nature, the arts, creativity, and spirituality, spiritual exploration, and that's where the diagram actually needs to be updated. So the center would actually house all these. You would come in and it would house all these different professionals and experts in wellness and human potential, and you as the individual would be going through and learning from their guidance and their support, but really mostly really using them to guide you back again to your inner power. So with that, we're going to start first here on this floor. This is our second floor of Amani Health. We're going to start with the yoga room. So the center would have a room, a space much larger than this potentially, because this space is really, we're again in a smaller space. This space is used to teach people the power of yoga and mindfulness and breath and mindful movement, and again, accessing their power and potential. So here, the role of the yoga teacher in the Real You program or at any health center would be to educate and provide guidance on the power of breath, awareness, and mindful movement to harness innate healing potential so that each person realizes they are a powerful resource in managing their own health and well-being. Here we created a mindfulness and meditation program, very short, again, just for educational purposes. So because our space was limited, it would be a place where people can come in, learn what is yoga, how do you do it? So you might be somebody who's, in their 60s, has multiple chronic conditions, can't move at all, don't want to really be with a big yoga studio. You would come in here, you would learn the power of yoga and getting better. Or you may be an elite athlete. You would learn the power of yoga and getting better and prevention of disease and health potential. Or you could be somebody who's had trauma and wants to be in a smaller setting. And you would, again, under the umbrella of physicians in a wellness medical clinic, you would learn the power of yoga. So we've had our Power of Mindfulness Practices program, and we would, for example, show people, did you know that yoga and mindfulness can affect cardiovascular health, mental focus, clarity, sleep, blood pressure, core strength, anxiety, and depression? And most people don't know. I'm not going to guess how many physicians do yoga, but I can tell you it's probably less than 20 or 30% of medical doctors do yoga. And I look forward to the day where everyone in healthcare in particular has a yoga practice of their own in order to really learn about how, again, the human body can harness its own innate healing potential. So originally we had set up this room as a psychology room, but again, that was several years ago. Since then, I would really rename this room and rename these posters and call it the mindset room or the mind training room. And that would be, again, like I said, you would work with somebody who has really committed their life into understanding the power of our thoughts, how to use awareness of our thoughts to move again to a place of not just thinking positively, but becoming aware, training our mind to becoming aware of the fact that it's a monkey mind. It has thoughts going all the time, and letting those thoughts by that awareness settle down so that then the clarity comes into place. And within that clarity in the present moment is where our power lies. So that could be, you could do that work on your own. You could do that work through the help and support of a psychologist. You could do that work through this help of social workers, psychotherapists, life coach, or a combination of all of the above, in addition to what's called bibliotherapy, which is using books and writings of amazing people who have lived in the past or currently who have mastered their own mind. And that's, my favorite people are like Lao Tzu, the Chinese philosopher, Hafez, Rumi, the Persian poets, Khalil Gibran, poet, Krishnamurti. There's so many. You could use biblical texts, scriptures, the Bhagavad Gita, whatever it is that actually resonates with you. You can use actually in terms of transforming your mind, but more importantly, using awareness of your thoughts that leads to the transformation. There is no resistance of the thoughts. And this would be the space that people would come to do that. So this is one of the most exciting places in the Center of the Future today, and that is the fitness facility. So every center would have a place like this, a space like this, where you could come in, even starting as as little children. I've had kids come through and they just love it. You would learn about your fitness assessment. Someone would assess you physically. Someone would show you how to do the key exercises in moving your body that you enjoy to, again, prevent disease, treat current symptoms of disease, or reverse disease altogether, and optimize your potential as you get older, so that really the vision is, we can live into our 90s, 100s and over and be independent, upright, great posture, not requiring any medication, and just enjoying life and sharing our gifts with the world. who would be in this space to teach you. We've used physiotherapists on our team before, currently and before, but you could also have kinesiologists for sure, personal trainers as part of that team, and also physicians who've done more training and education in the role of exercise or movement as medicine. Okay, so welcome to the pièce de résistance. This is the third floor of Amani Health, and where the medical doctors, the experts in nutrition, and some just extra fun and gathering space lies. So we're going to come here. This would be a typical but sort of more glamorified nursing station, and also station where you would have your healthcare administrator team helping you navigate your appointments for your wellness team. And what's our prescription at this health center of the future today? It's our people. So the health centers of the future would have the people, like we went through the different disciplines, guiding you again in those different disciplines to the knowledge base and the skills that you can learn within the field of nutrition, movement, etc. So we have here our caring team members allow you to take ownership over your own health. The truths that we share and the tools we provide are natural and simple. You can understand your health. You can meet your prescription. So who doesn't like a great massage? Everyone does. But massage actually has way more power than just you being a passive recipient, lying down and enjoying it. You can do that, and that's all wonderful. And who doesn't love that? There's a whole other level that massage therapy can actually help us, again, prevent disease, treat current symptoms of disease, and access our human potential. As a physician, I didn't learn this until only a few years ago, actually several years ago, when I started studying through my own personal, musculoskeletal issues, but also in working with patients. And we had a phenomenal massage therapist on our team who we introduced the massage component of the program as preventative, as a check-in for people to work with the massage therapist to learn about their own power of their awareness and their breath and how that connects to their tissues, and releasing tension within their tissues while they're getting the massage through that practice of their awareness and their breath. So what does that mean? That means that if I have tension in my shoulder, I can come into a massage therapist and get a treatment for it and have it, massaged. But if I were to be trained by the massage therapist who has the, again, education and the knowledge and the awareness that they can direct you to using your own awareness in your breath, you can actually release very, very deep tension in your tissues, and actually mental tension and emotional tension. So we can use massage therapy like we've been using it in Western medicine as a passive modality for treatment, but we can also take massage therapy to its full potential with the right guidance and the right therapist and the right education to the person who's getting the massage, and use it as a preventative tool, as a tool to connect your own awareness and your breath to your body, which once you leave the massage, you can actually continue that awareness so that you know that, for example, if I'm sitting in a certain situation, because you've had the training during your massage education session, if I'm sitting in a certain situation, or if I'm holding my shoulders really high, because you've had that training, you will know how to readjust and release that tension in your body. Why is releasing tension important? Because tension over time we know causes pathology, but tension is equal to weakness, whereas calmness or relaxation is equal to our power. That tension can be in the body, but that tension in the body is also connected to tension in the mind and in our feelings. So we want to release tension in our feelings, in our heart, in our mind, and in our body, because that is equal to calm, is equal to relaxation, which is actually where our power lies. So this is now my office, or the office of any healthcare practitioner on the team. Obviously, lots of natural lighting, place where we could sit and have conversations around. My visits are an hour long, so they're not short visits. So this place has to be comfortable, bright, uplifting, and we can have conversations with not just the person that I'm working with, but their family, their partner, their children, and talk about their health and wellness journey. Obviously, medical things happen as well here. We have a lot of different handouts, educational tools in our program. So this is like just an easy top breakfast options, what they can eat as part of our nutrition program. Sometimes I'll review some of that as even the doctor within the program with them, and as a repeat and a reaffirmation of what our nutrition team members have reviewed with participants. We also have a lot of handouts that we've created over the years. This one is on, for example, protein, and that's really the focus of our program. So I can review these within the context of the program as a medical doctor if that's my expertise. I do have that, and I've trained myself to have that within the program. But also the nutritional person on the wellness team can review that, and the doctor can reaffirm it. Sometimes, hopefully this won't be the case in the future, but sometimes just the medical doctor reaffirming, how nutrition can help the patient in terms of their blood pressure, their weight, their cholesterol, their pain, has a more of a sort of hit at home effect than maybe someone in just the nutrition team alone. My hope is that that's not the case in the future. We recognize every healthcare practitioner that is an expert in their field and really guide people to those expert practitioners in conjunction with the medical doctor. So this is a second medical office in our center, and this is an important office as well because it obviously has the typical medical equipment that you would need for the blood pressure and the otoscope, etc. But it has a very, very important feature, which is my white wall. And this wall is where I go through really important concepts with people about their journey into health and well-being. I'm going to go over a couple of them with you today. So basically, one of the top is do the right thing with no attachment to the outcome. That really puts us center in the moment and focusing on what is it that I need to do without doing something with the idea that I'm going to get anything in return or in the future. The second concept that I like to go over with everyone is that our awareness precedes our evolution or change. So we don't need to force or push through to change ourselves. We're already perfect and divine and whole as it is. We just want to spend time becoming aware of our thoughts, our feelings, who we are, how we're living our life, so that we're not on autopilot. We're actually taking the power that we have within us and using it through that awareness to evolve naturally like plants do. So I bring in a lot of the examples of plants in nature in my own life, in our work, to help people guide them to their potential. And that's a little bit of that here. This is for fun to let people know it's huggle time. So hugs and cuddles, getting them thinking. This is another part that I focus on, which is, your heart and your head and your hands. You want, it says mind, but it should say hands. So we want our thoughts and our heart, our feelings and our hands, our actions to be aligned. We want to get to a place through our awareness where we're acting from the same space as our heart and as our thoughts, because in that state, we're not in tension, we're in flow, or we're in relaxation, we're in a calm state of basically allowing the highest action to be done through us. The last thing that I want to touch upon here is that, a couple of things. First of all, that we're all connected. Our own health and well-being will impact the health and well-being of others. And that's the greatest actually power that we do have in changing not only our own life, but in changing the world that we see outside, is by caring for ourselves. And to be really aware of the top fears that we have. And right now, the COVID crisis has made us very aware of many of our fears, and to really come from a place where we're acting consciously with awareness, based on love rather than fear, because the two outcomes, if we act based on fear, we have a very, very different outcome for ourselves and the world than if we're coming from an action based out of love. Last part of this room is what is the ideal role of a physician in a healthcare team. So the role of the medical doctor in our program, the Real You program or at Amani Health, is to provide a whole person medical care, including comprehensive screening, physical exam, referral to specialists if needed, but most importantly, education on the relationship between the mind, body, and spirit in our health and well-being. Your Real You or Amani Health or Center of the Future Medical Doctor is the guide that has your back, championing you on your journey towards your healthiest potential. So now we're on the second section, the other side of the third floor here at Amani Health. Here is where we have basically a place for people just to sit, reflect, look out the window. We're encouraging doing nothing, sitting, and just being. And I'm going to take you from here over to our boardroom, which is a very important room in the health center. This is where the team, everyone on the person's team into journey into wellness, gathers, we meet, we talk about how the participant is progressing in their program. So this would be the nutritional expert, the medical doctor, the physiotherapist. We would basically have what you would have in the hospital when people are sick, grand rounds. Well, we would meet as a team regularly, not only through our electronic records where we're communicating about the participant, about the person going through the program, but also here in person where we learn, we talk about what successes we've had with participants in reversing symptoms, reversing conditions, or what challenges we have. It's a great opportunity for us to meet as a team, for us to collaborate, for us to learn from each other, and for us to see how can we best support the person in their health and wellness journey. The other part of this room that can be really, really important to use, and we haven't done this yet, is having group meetings or group wellness sessions with participants. And that is another really important role that the center would facilitate, is having group discussions on topics such as nutrition, fitness, that people who are going through the program can actually talk to each other about and learn from each other and really peer mentor one another in their wellness journey from what they've been able to achieve. Remember, really important, one of the outcomes of our program has been, one of the outcomes of you just owning your own health and wellness power is you become a role model for everybody outside. So for every one person that comes through here, through the Centers of the Future, through your own personal transformation and commitment to your own health and well-being, you then role model that potential to other people. And you now can become as effective, if not more actually, than healthcare practitioners who aren't taking care of their own health, who aren't aware or educated in the role of lifestyle and mindset as medicine. Because now you are living healthy, you're showing how you can live healthy and access your potential, and others can learn from you. And that is our hope, so that we don't need to see everyone in the world, but for every single person who's making that change, you now are able to impact hundreds, if not thousands of people around the world. I hope you've enjoyed the tour of the Health Center of the Future today. This has been a project that's been 20 years in the making, and I'm so excited and so happy to be able to have shared this with you. This vision is something that I think requires every one of us to first imagine and then to bring into form in every major city around the world. These beautiful places where every child, every adult, every senior, every person anywhere on their health and wellness and human potential journey can come in, they can meet each other, they can meet people who have dedicated their lives to helping people become healthier, stronger, happier, more fulfilled, and they can learn from them, they can share their own knowledge with them, and together we can create a more peaceful, because health equals peace, happier, more just, and more fulfilling and creative society. And I believe that one of the key ingredients to make that happen is to have these types of centers around the world. Please work together and make this happen. This is the time.